Good morning, everybody. Dr. Arafich here from Vet Triage, August 4th, 7:50 a.m. Pacific time. Let's talk about referral to a surgeon. So I am a board-certified surgeon myself, um, pet owners, especially these days, less these days than we used to be, but a lot of them don't realize that we have specialists, and these specialists focus on a specific part of veterinary medicine. So surgery is one of those specialties. If your veterinarian either feels as though you need that level of care for whatever reason, maybe your case is complex, maybe they don't perform that procedure at their hospital, um, whatever it may be, and you're able to access a surgeon and potentially afford their fees, because of course they'll be more expensive than your family vet, but they have all that added expertise, then they'll refer you to the surgeon. So typically, when you're going to the surgeon as a referral, your patient has obviously a surgical condition, and that surgical condition may or may not be an emergency. Both are very common. Non-emergencies like torn ligaments or luxating kneecaps are commonplace, and then emergencies like disc herniation for paralyzed dogs or foreign body ingestion or whatever it may be. There's tons of different diseases, but that's what your vet will refer to the surgeon for. So you may be rushing over to a surgeon that night, that day, or you might be planning it for weeks or months in advance, depending on what's the disease process you're talking about and how urgent your veterinarian feels it is. So then your vet will probably have diagnostics in their possession from your pet, blood work, x-rays, whatever, and they're going to send that information to the surgeon. That way the surgeon knows ahead of time what it is that is going on with your pet, and they can talk to you about the specifics of that once you show up for your appointment. So then you meet the surgeon, and they're going over the testing that's already been done, and then there'll be a few avenues to take. Either, maybe you don't need surgery, maybe you need medication or physical therapy or whatever. You might need surgery, but we need more testing to be done. Or we need a surgery, and here are the different surgical options we may or may not have, and the pros and cons and the costs and everything of each of those options. So those are pretty much the outcomes that are going to generally occur when you're visiting with a surgeon. Now, some surgeons are even further specialized, and I'll go over that now. There's three different categories of surgeries. One is soft tissue surgery, one is orthopedic surgery, and one is neurologic surgery. So neurologic surgery is anything related to the nervous system, so brain surgery, spine surgery, typically. Orthopedic surgery, anything related to the bones or joints. So limb amputation, cruciate ligament tears, knee luxations, broken bones. And then soft tissue surgery is everything else, whether it's intra-abdominal or in the chest, on the skin, whatever surgery you need for those body parts. That's what soft tissue surgeons do. So I was trained in all three, and so that's what I'm specialized in. However, the surgeons has the option, depending on what their interest level is, as to which category or categories they want to partake in. There are typically surgeons that either will do all three, like myself, or there are some that only do orthopedic and some that only do soft tissue. The neurosurgery part of this is interesting, because neurologists are also somewhat too heavily trained, depending on the program, in surgical techniques. Not every neurologist has the desire to dabble in surgery, and those that don't become medical neurologists, and those that do are surgical neurologists, which is a different perspective, different lens than a surgeon who gets taught neurosurgery. So there's some overlap there with the nervous system with neurosurgery. The same thing occurs with dentists. There are some dentists who are really avid about performing surgery. That's a big part of what they do. So some feel adamant that they perform the dental surgeries themselves, whereas there are plenty of surgeons that feel comfortable with dental surgery, oral surgery, and then there's other types of maxillofacial conditions like fractures, for example, that some dentists will dabble in fracture fixation and some will not. And whereas most surgeons, at least those who at least perform orthopedic surgery, are okay with repairing maxillofacial injuries like fractures and whatnot. So there's overlap there. But your surgeon will go over everything with you at the time of the appointment, and then from there, follow up is dependent on your case and your ability to access the surgeon. If you live 3 hours away, then other than the main surgical part, you probably won't visit the surgeon again unless there's like a true emergency or true condition concern that the surgeon needs to be involved in. It's a 3 hour drive, so hopefully your family vet can take care of that. But if you're looking at a condition that's always going to change week by week, month by month, then you might be visiting the surgeon a lot more often. And it just depends on what procedure you're talking about. Um, if they removed a lump on your dog, that's a 2 week post-operative recheck, and then you're probably done with the surgery after that. If you had spinal surgery performed on your dog, you're probably going to see the surgeon maybe every month or so for the next 3 to 4 months minimum to see how things are going with the patient. So it really varies depending on what condition you're talking about. If you performed the knee surgery and x-rays are needed by 10 weeks post-operatively, well, then you'll probably see the surgeon once after surgery within about 2 weeks to look at the incision and stuff. And then hopefully maybe one more time before the x-rays are collected in 10 weeks, usually with the surgeon. But again, that's not always the case. It depends on your travel situation, what you can afford, what your family veterinarian is comfortable doing, what the surgeon is comfortable with. It all just depends on what the surgeon's preferences are and what their tendency is to manage certain cases in a certain way. And the other aspect to surgeons, they usually have all the fancy tools. They've got different diagnostics like computed tomography, which is CT scan or CAT scan. They've got, they may have magnetic resonance imaging, which is MRI. They've got all these fancy surgical equipment, tools to use for surgeries, and and then of course they have all the expertise from training. So that's why you'd be going to a surgeon, and that's why your family veterinarian would probably turf you on over. When you might need a surgeon but you can't go is because either there's a traveling issue, it's too far away for you to get there, or it's just too pricey. And there are some surgeons, some doctors, general practitioners who are comfortable with performing certain surgeries, and there are others who are not. And some will be honest and they'll say, look, I could try this surgery. I haven't done one in years. I've never done one before. But if you're telling me that you can't see a surgeon that add expense and expertise, and I'm your only chance, and I'm willing to try. And if your pet will, suffer or die because of a lack of surgery, then, you as a pet owner can decide what you want to do from there. But that happens as well, and that's fair enough. Yeah. So once the surgeon talks about the surgery, they're going to go over complications, follow up, risks, costs, all that stuff, and there'll be discussion there as far as like what surgical option might be best for you as a pet owner or for this pet in particular. If your surgery gives you 3 different options for how to fix something, it may be that your dog just not a great option for option number one. And then the 2 other options are probably better off knowing your dog's personality or breed or age or whatever. So all these factors come into play when you're talking about trying to decide between like different surgical options. But yeah, so that's probably good enough for today. That's what the surgeon will do. That's what you can expect as a pet owner. If you have any questions at all, feel free to message me. Thanks for those who watch us on the playback and who are donating and subscribing, hitting like. I will see you guys tomorrow, Monday, August 5th, for another live stream. I'll talk to you then. Bye.